2000.
Welcome back to Wave 3 Listens. Dr. Eli is here. He is a licensed marriage and family therapist. If you'd like his help via telephone, 571-5263, or let me give you that, the email address is, we're going to throw it up there.
Yeah,
it's KAMFT@twc.com. All right, Dr. Eli, I've got another email question for you.
Let's do it.
All right, you ready? Dear Dr. Eli, I'm currently being treated by my physician for depression. He suggested that I try talk therapy in addition to medication. Should I bring my husband with me or go alone? Good question. Thank you, Angela.
Very good question, Angela. So, when you have a kind of diagnosable disorder like anxiety or depression, there's actually a lot of good empirical research that says, more than, there are no magic pills, even though if you have a biological basis toward depression, certainly you need, many people need medication to, as I say, create the space, the wherewithal to do the talk therapy. So believe it or not, when one partner is depressed and there's marital conflict associated with it, and in most relationships there are. If you're depressed, if you're feeling stuck, you're not yourself, you're not getting out and doing things, maybe not carrying your weight at home, it's probably going to cause marital conflict for your spouse. So all the research says that couple therapy, when there is marital conflict and depression, is the way to go. So of course, bring your spouse, and even if you're an understanding spouse and you're not blaming your partner for their depression, it's still what we believe in marital and family therapy, what we call the interpersonal premise, that if you can learn all the cognitive behavioral skills, the kind of mental tools to overcome your depression, it's great. I mean, you can do that individually, but it's even better if your partner's there, even if they're present without being super active, because they're learning those skills too with you. They're learning the strategies around, again, cognitive behavioral therapy, around how to do, think, and feel differently. So you don't have to go home and translate. And often people in individual therapy run into problems because their partner outside of the room is supporting them, but they want to know what's going on in the therapy. They want to know how they can help. And sometimes having that partner in the room, especially if you're coping with depression, can really help. So of course, very good email. Marriage and family therapists can help with depression, either individually or with your partner or family present. And again, the emails is the best way to get us at KAMFT, it's the Kentucky Association for Marriage and Family Therapy, at twc.com. And these are the very emails that we get in and we answer every Thursday on the show.
All right, another question for you via phone. Corey is with us. Corey, thanks for watching. Welcome to the show.
Yes. Hello.
Hi, Corey.
Hello.
I was wanting to know, my husband and I have been married 10 years, and we have experienced quite a bit of loss in our family. I lost my 20-year-old daughter 8 years ago. I lost my other daughter's baby's daddy had died in a car wreck 3 years ago. My 20-year-old nephew, who was suffering from a lot of depression, decided to commit suicide by hanging himself at my sister's house. And now it was 2 weeks before his year's anniversary, which was this March. My 13-year-old niece did the same thing. So I have been really, really depressed. So it's very hard on my husband to understand this, and I'm just trying to know what better ways I can communicate with him.
Well, I am so sorry for your losses. That's certainly a combination of losing multiple people close to you in a short period of time. So it's really hard when you go through that to really kind of question your family, your life, why this had to happen. So it can be a very isolating feeling, as I'm sure you've experienced, and that's why being able to talk about it, having sounding boards, are very important. So a couple things, these losses, a lot of times when they involve family, we think of our own grief and how we're dealing with it, but most of the time it's a shared loss. So probably your husband as well, whether he's an open communicator or not, has experienced this loss too. So it's really a powerful time to share that, because it is, like I said, an individual loss, but also a shared family or couple loss. So talking about it is important. So you can, if you haven't started that dialogue, and some people have a hard time talking about it because it brings up a lot of really negative emotion, whether that be sadness, guilt, shame, especially in the case of suicide. So you want to be able to talk about it with your partner, and exactly, again, it's what marriage and family therapists do. They will give you a way to talk about it that minimizes your shame and pain, and also helps you honor those deceased people. And it's kind of a ritual, a closing ritual. Many people have loss, but they never have a closing ritual that honors the deceased, but also helps the people that are still living, left behind, move on. So marriage and family therapists are certainly experienced with death and bereavement, and they can help you not only talk to your husband about it and get some closure, but hopefully move on in a way that honors those loved ones that you lost. Thanks very much for your call, and again, I'm sorry for your loss.
Thank you so much.
Thank you, Corey. I appreciate it. Boy, that's tough because, you know, there's no set timetable. It's a process, and to get over what she has been through, I cannot imagine. I would think a marriage and family therapist would be good for her, if for no other reason, just to talk it out with someone.
Exactly. To have that sounding board, that empathic voice to kind of normalize and tell you what's going on. I should say also, when you're dealing with loss, sometimes people will tell you, I mean, the first year for many people is such a cloud, and you just get on with life, whether you're losing a spouse or a child or a loved one. It's really the second year that is the hardest for most people, and that's when the realization is that this loved one is not coming back. You are, you know, without them, especially if the relationship did not end the way you wanted it to. Your last encounters with them was not good, and that is sometimes difficult too. It's one thing if we lose a loved one and things are going well as far as our relationship. It's another thing if there was a conflicted relationship ahead of time. So very, very difficult. Yes.
All right, we have about 2 minutes left here. I got a quick another email question. Hopefully you can handle it in 2 minutes. Dr. Eli, I've recently begun divorce proceedings for my wife. I'm seeking joint custody and have 2 children, girls, ages 10 and 15. I'm not sure how they feel about all of this. Typically, what do girls this age worry about? Dad, I see where you're coming from. There's a good one. Lynn from Louisville. Your thoughts, Doctor?
Yeah. A great question, especially lots of times when you have, you're a parent, you have opposite-sex children, in case a male with 2 teenage daughters. It's a very good question in the sense that most girls, and boys for that matter, they think about at this age, most of them, unless there's some reason really the divorce is because some parent did something very inappropriate, most kids want to love both parents. They don't want to choose sides, even though sometimes in the heat of divorce, parents kind of fighting through their lawyers, make the children choose sides, but they don't want to do that. So they want to love both parents. That's what they're thinking about. They're also thinking about normal stuff teenagers do. Where is my stuff going to be? Where am I going to live? Where am I going to go to school? Am I still going to get to see my friends? So they do not want the divorce to disrupt their life, and especially during these high school years where your peer identity comes so much from the people you go to school with and your friends, if not more than from your family. So they want to know stuff like that. And again, a marriage and family therapist, they work with just as many divorcing families or separating families as they do intact families. So another good reason to go to www.kmft.org or www.therapistlocator.net and find a marriage and family therapist to help you with your life transition, whether it be divorce, death, any of the things we've talked about today.
Dr. Eli, fantastic. Excellent job. A lot of phone calls. It's tough, but boy, you are good.
Thank you, man.
Will you promise me you'll come back?
We're coming back next week.
I love that. All right, next week, Dr. Eli will be here Thursday again?
Thursday.
Thank you very much. Really good advice. And remember, again, I want to give that to you one more time. KAMFT@twc.com and therapistlocator.net as usual. All right, Dr. Eli, thank you again, and we thank you for watching. Hang in there, because in the fight against cancer, we have a friend. It's called the cyber knife. Dr. Dunlap is on the show, and he's going to tell you all about it next on Wait 3 Listens.